Hi, I'm Lori Babin. I work at Como HealthPartners. This is HealthPartners Bargaining Update number 2, December 5th, 2019. We met twice again this week. We covered some language typos and some other non-financial issues. There were some employer proposals regarding probationary employees and employees with active discipline. Management is asking for bidding restrictions, and we disagreed on this issue. There are also some departments who bid vacations together, such as the lab, who are asking to change their bid periods. We are still working on this issue. Management also wants to restrict overtime to over 40 hours per week. They want to take away daily overtime and other overtime provisions instead of appreciating the hard work we do, because the projected overtime for 2019 is nearly $3 million. If we had adequate staff, we would not need this overtime. We are still pushing for language on funeral bereavement leave for aunts, uncles, nieces, and nephews. As you can tell, we are working on a lot of technical issues, but we understand that most members are concerned about changes to our healthcare benefits.
Hi, Connie here from the Woodbury Laboratory, and one of those proposed changes to our healthcare is Smart Care. If you haven't heard of this, let me fill you in. This is our new model for healthcare proposed to us from our management that we would have to use. Under this model, you would receive primary care from one of 4 Smart Care clinics located in St. Paul, Maplewood, St. Louis Park, or Burnsville. For specialty care and hospital care, you will have a select, very small group of providers chosen for you. What this means is you would only have these 4 clinics to get your care and will no longer be able to see your current provider who knows you and how to care for you without paying out of pocket. So the question is, what happens if we all sign up for Smart Care? Will we be able to be seen and get the care we need in a timely manner? And if you don't live anywhere close to one of these 4 clinics, what will be your options? I guess that's something for us to think about concerning ours and our family's care.
Hi, I'm Katie. I work at the HealthPartners Como and Midway Dental Clinics. I'm going to give an example of the employer's proposed cost shifting onto all of us and how it could affect my family and yours. A few months ago, little 2-year-old daughter got a little bump on the head, tiny little cut, bled like a stuck pig. At that point, under the new proposed plan, I would not have had time to call Smart Care and talk to a doctor and figure out if we can go over the phone or have an office visit. We had to instantly get to urgent care. Under the new proposed plan, going to urgent care, if my husband and I had not done our healthy assessment, which is part of the new proposed plan, we would pay $50 at urgent care. They recommended we go to the emergency room for a possible scan. Took my daughter down there. Under the new proposed plan, that would have been an additional $100. If she had needed a prescription, brand prescription, that would have been an additional $30. All in total for just that one day would have been $350. Currently, under the classic plan, with a $70 a month plus a possible $40 emergency room fee, I paid $110 versus the new proposed plan of $350. Under the choice plan, if laid out the exact same way for one day and 1 month, it would have been $535. I have a 2- and 4-year-old. They fall and they get bumps and they get scrapes. If even 3 times a year under the new proposed plan I had to bring one of my kids in, it would be upwards of an additional $720 under the classic plan and an additional $1,110 under the choice plan. This is what is at stake here.
We meet next on December 12th. Stay tuned for more updates. You can go to our website at SEIU healthcaremn.org and look for the HP bargaining tab at the top.